Thank you, Bill. I'm going to shift gears a little bit and just tell a story. And the story is to illustrate a few things. One, it's to hopefully you'll walk away with a sense of what is a cancer cluster. Another is what is pleuropulmonary blastoma, what is rhabdomyosarcoma, and then the most important take-home message is what can you do in your own community, because that's where the story, it's not over, but that's where the story started and that's where the story has evolved. So I wore 4 hats. I now wear 3 hats. I am a gastroenterologist. I used to practice in Warrenton for all the people from Warrenton. And we've figured out that my wife was their dermatologist, and they've carried the banner by working with the Shine More, Tan Less, or Tan Less, Shine More. And this is the Highland motivated program to decrease the risk of skin cancer. But we moved to New Hampshire, where I was elected to the State House, and I'm really honored because my colleague David Borden is here, and he and I were state representatives together in New Hampshire, and it was just an amazing 4 years working together. So that was hat number 1, is that I'm a gastroenterologist. Hat number 2 was being a state representative and a legislator. And hat number 3 is that I'm a father. I have 3 boys. Hat number 4 is being chairman of the board of Less Cancer. So with those 4 hats, I jumped into the legislature, and in the beginning of my 2nd term, I got a call from a woman who is a resident of my town, which is Rye, New Hampshire. Now, we live in a beautiful town. It's right on the coast of New Hampshire. Many people don't realize New Hampshire has a coast. It's about the shortest coast in the entire country, but it's spectacular. We're a quarter mile from the ocean, half mile from a beautiful long beach. And a lot of people come here. We have this huge seasonal influx of people coming to swim in the Atlantic. But the most important part of that experience was this one phone call. And this phone call was to raise awareness for me as a state representative that we were seeing some extra cases of pediatric cancers, rare pediatric cancers. That same person made a call to the State Department of Health and Human Services. And with that, when you report a concern about too many cancers of a certain kind to your Department of Health and Human Services, the state actually then starts an investigation. And what they're trying to figure out is this statistically a problem? Is this statistically something that we need to pay attention to? So what the state then did was they said, well, we're going to look at this area. It started out with 5 towns, and it became 10 towns. And we're going to do a 10-year look back at the New Hampshire Cancer Registry, which is managed by Dartmouth. And what they found over 2 years, it's kind of hard because where we live, patients go up to Maine Medical Center, or they'll go down to all the programs in Boston for their cancer treatment. And we don't have a major medical center right on the seacoast of New Hampshire. So gathering all that data actually took about 2 years. And in February of 2016, we sat down with the Department of Health and Human Services with their report. And indeed, statistically, there was a cancer cluster. So what is a cancer cluster? A cancer cluster is based on a statistical measure called the standard incidence ratio of cancers. And you look at that over the number of expected cancers in a control population. So what the department did was they identified a 5-town area that was similar to ours, and they looked at what that 5-town area, what their experience was, and then they looked at our experience. And we had a standard incidence ratio, or a SIR, that was elevated statistically, and we met the definition. The 2 cancers that fell under this cancer cluster, one was rhabdomyosarcoma. It's a fairly aggressive tumor. A sarcoma is a soft tissue tumor, or it can be actually, it's a mesenchymal tumor. Rhabdomyosarcoma typically is in children. It involves the head and neck. It can involve behind the orbit. And outcome really depends on how early it's caught. The second cancer was pleuropulmonary blastoma. And in we'll call it PPB because it's hard to pronounce. But PPB really, you generally have a genetic tendency towards it before you can get it. And the children, this is actually was in the paper, so it's public knowledge, but the two children who had it in our area were a brother and sister. And the sister was diagnosed first. She's gone through 6 surgeries, and her brother was diagnosed because of her disease, and recognizing they had the gene, then they screened him and found that he had a tumor in his lung. And both of them, fortunately, are disease-free right now. So what happens when a community, a small, close-knit community, is told there's a cancer cluster in their own backyard? Well, you can imagine there's a huge public outcry. And that public outcry is led by parents who are worried that their children might get sick. They're worried about where is this coming from? Is there an environmental cause? And the result was multiple meetings with the public. And as one of the state legislators, and David was the other state legislator for that area, we were at many of these meetings, as was the Department of Environmental Services, the EPA staffed some of the meetings, and DHHS, Department of Health and Human Services. With all these meetings and all of this need to understand what was going on in our environment and with the health of the children who were affected, I went to the governor and said, Governor Hassan, who is now our senator, and she joined us yesterday, which was lovely. I went to Governor Hassan and I said, we need a mechanism for collaboration and coordination of the effort. And that became the governor's task force on the Seacoast Cancer Cluster. And when you come up with an idea like that, this is really important for you guys to understand, somebody puts you in charge. So I'm chairman of the governor's task force. And what we've done with the task force is we've gone down 2 major, what we call swim lanes. Swim lane number 1 is understanding the disease in these children specifically and looking very carefully to see if this cancer cluster, if there is an environmental cause, or what is the cause? Can we find something that's common to that cancer cluster? And when you do that, you're following a CDC guideline. The first step is you do the population level study. The second step is you develop a questionnaire that really looks at the individual exposures and risk factors that those children had. And the third step is if you are still coming up with a positive, yes, there are risk factors, or that yes, there is a sense that this may be a pattern. The third step in evaluating a cancer cluster is to actually do a case control study, and that's much more involved. And in the state of New Hampshire, and Mindi, you might be able to help me with this, but no cancer cluster investigation has ever gotten to the level that we're at right now. And nationally, it's also extremely rare that that happens. So we are at the second phase, which is the questionnaire phase, to understand the individual risk of all the children who've been affected. And the Department of Health and Human Services has reached out to Maine and Massachusetts as well to try to see if there are other cases that would fit our case definition. The other swim lane is when you start asking questions about environmental exposure, you start getting a lot more questions. So in our neighborhood, which is, by the way, it sounds frightening, but this is America. This is the way it is in all of our neighborhoods. I was talking to the students from Highland School that we have a few Department of Defense installations out in Warrenton, and they've actually had issues with some of the toxins that were dumped up on off of Bearwalla Road out in Warrenton. So this is our neighborhood. This is the U.S. neighborhood. We have a nuclear power station. We have a naval shipyard. What do they work on? They work on nuclear subs. We have Schiller, coal-fired and biomass power plant. We have the retired Pease Air Force Base. And then the last one, which didn't even make it to the initial report because nobody really was aware it was there, sitting right in the middle of this 5-town area is a landfill called Coakley. And I'm just going to talk briefly about Coakley because I think this is really, when I think about a lot of what many of the people who are here are working on when it comes to environmental toxins and environmental contamination, we have a history of at least 50 years of virtually unregulated industrial dumping, whether it's through our military or whether it's through our industry. And talking about advocacy for our future and for our kids, this is why we're here today, is there are things we do to ourselves, like smoking, drugs, obesity to some extent. But there are things that we have very little choice about, and one of those is our drinking water. So Coakley is the highest point, or about the highest point, on the seacoast. It was a great source of gravel. So they dug out all the gravel, and then you've got this pit. And what is the economic thing to do with a pit? You fill it up with garbage. But the garbage is commercial waste. It's waste from Pease Air Force Base. It's waste from towns, commercial haulers, and they just fill this thing up. But remember, it's at the top of a hill. 4 different watersheds start from the top of that hill. And this is, you think of, we're the granite state, so we've got this powerful granite. Nothing's going to go through that. But actually, this particular area is more like a sieve. It's not much of a filter. Stuff can run right through it. It's more like gravel. So the actual threat to the community becomes much higher because of gravity and because of the way water flows out of this one site, which is now filled with very toxic substances. So we identified these 5 sites. And one of the first things we did, recognizing the importance of Coakley, was the task force formed a subcommittee. And the subcommittee has gone on and held DES, EPA, absolutely accountable for the water quality for not only what's happening up on the hill, but also the surrounding subdivisions. So the story continues. We're right in the middle of it. And hopefully what you've gotten a sense of is when you have something, it takes one person, just one person, to put 2 and 2 together and come up with a notion of, gosh, there's a problem here. And when we're talking about cancer prevention, the number of lives that can be saved and the number of cancers that can be prevented by one person coming up and saying, I think we've got a problem, and reporting that problem and allowing it to be investigated and helping to drive the investigation is a life-saving cancer-preventing role. So at the end of all this, I want to tell you that we are really honored today because that person is here in the room today with us. Not only did she do all of that, but because she's a hydrogeologist, it took me a while to get that term down, a hydrogeologist, she also came up with a lot of these ideas. So I did what the governor did to me, and I put her in charge of the subcommittee looking at Coakley. And I went one step further, which was when I decided not to run for the House again, I cajoled and coaxed her into running for my seat. And so she has gone in as a freshman legislator in the state of New Hampshire and is leading the charge with 4 bills to make New Hampshire's water safer for everyone, to continue the work of the task force, to start making the connections between water supply, environmental contaminants, and public health. And today, I'm honored to give her the Leadership Award from Less Cancer for her work, and I know she will continue to do that work. I'd like to welcome Mindi Messimer, State Representative from New Hampshire. This is for Mindi. Thank you so much for what you do. And would you like to say a couple words?
Just a few. Thank you so much. It's been a pleasure to work with Tom and David Borden over the last year or so, and actually a couple of years. And I just want a message to all you younger people here. As Tom said, get involved with your local politics, get involved with your local issues, contact your representatives, tell them what bothers you. Make sure you can make a difference at your local level. You really can. Thanks.
Thank you, Mindi.